So a lot of the same messages that we're hearing from our local government, which is around frequent hand hygiene, using soap and water to wash your hands, or an alcohol hand sanitizer. You can use your elbow to cough into, minimising close contact with people, so having a 1.5 metre distance between you and other people. Reducing gatherings, so no big family barbecues anymore. Really taking it seriously around the interactions that we have. So the first line recommendations by our government and also by the World Health Organization are household bleach. So diluted household bleach, you can follow your manufacturer's instructions. That's the best bet for killing the virus. If you don't have access to bleach for some reason, or you don't want to put bleach on a particular surface, you can use alcohol. And the alcohol must be 70% concentration at least. That's the recommendations from our government. And you should be wiping those at least once a day. So the recommendation, if somebody is infected with the coronavirus, is that you should do it at least once a day. And areas that are high touch, like doorknobs, light switches, lamp posts, your phone, etc. Of course, you're not going to wipe over your phone with bleach, but you should use alcohol for that kind of thing. And that actually should be done multiple times a day. If you do test positive, you'll be required to go into self-isolation at home, and that's quite strict. It's absolutely no contact with others if necessary. If you live in a house that you share with other people, then you should stay in your own room. You should not share bedding with anyone. You should try and avoid sharing bathrooms. If you do have to share a bathroom, then you should also wipe that down every time that you use it. Cleaning your dishes in the dishwasher, because the high heat will aid with killing that virus. Now look, if you're in a house and you've got a backyard, absolutely get outside and get some fresh air. But if you are walking past other people, touching doorknobs, you need to wipe those over after you go.
And I think people need to realise they're doing this to protect themselves and their family, and they're also doing it to help protect society as a whole. Both of those things are really important. Secondly, they need to realise this is affecting everybody, not just them, and we all need to contribute to the effort to prevent this getting out of control, like, for example, happened in Italy. So in Italy, they're doing things like this now, but they started doing it too late. Their hospitals were overwhelmed. A lot of people have died there from this infection. We want to go more down the line of some of our Asian neighbours, Singapore, South Korea, for example, who had very effective public health interventions to not stop the infection spreading, but to slow down the spread, to spread it out over time, so that the healthcare system overall is able to cope and is able to treat those that need treatment.